Welcome back to Biomechanics on Catalyst University. My name is Kevin Tokoph. Please make sure to like this video and subscribe to my channel for future videos and notifications. In the previous couple of videos, we discussed several different movements of the scapula. We discussed scapular elevation, scapular depression, and then scapular protraction and scapular retraction. And we talked about how those were movements of the shoulder girdle. And remember from the previous video, the shoulder girdle does stabilize the shoulder joint, and it also moves the scapula, but any shoulder joint movement you have has to also have a shoulder girdle movement, okay? So anytime you move the humerus, there's a concomitant movement of the scapula. So these two things work together in tandem. The first couple of movements we're going to talk about are shoulder abduction and shoulder adduction. Now, it's very important to put that first word there, shoulder, in front of it because recall that we have both scapular abduction or scapular adduction. And so if you just say adduction, it could mean either of the shoulder or the scapula. So that first word there is important. That's also why I typically use the word protraction and retraction. All right, so what are abduction and adduction? Abduction is going to be moving the arms away from the body in the frontal plane. In fact, both of these movements are going to occur in the frontal plane. So for shoulder abduction, the example here would be when you raise your arms up, such as in the upward phase of a jumping jack, that's a great example of shoulder abduction. Some exercises or movements where you might also see shoulder abduction would be in lateral dumbbell raises. So if you have a dumbbell in either hand with your arms starting right by your side, if you raise your arms away from your body in the frontal plane, that would be an example of shoulder abduction. And even though in this exercise you wouldn't start with your arms all the way by your side, in a military press, which is an overhead press of a barbell, you at least have some shoulder abduction when you raise the bar above your head. And the major muscle that's going to be involved in abducting the shoulder is going to be the deltoid, but specifically the middle fibers of the deltoid. So here's our deltoid. Here's a look at it, our right deltoid in fact. And we have three sets of fibers. The middle fibers run right up the center of the deltoid. The posterior fibers are going to be in the back, and then the anterior fibers are going to be in the front. Okay. Now, they originate on different parts of the scapula right here. Okay, so different parts of this, as you can see, but they all insert at the same spot on the humerus, and this part right here is actually called the deltoid tuberosity. So let's think about this from a physics perspective. If the middle fibers were to contract, and they were to pull the humerus, or pull on the deltoid tuberosity, we could imagine that the humerus is just going to come up directly in the frontal plane. So if we rotate this and it was the middle fibers, they're just going to pull the humerus up and we're going to move it up like this, okay, just right in the frontal plane, okay. Now this isn't involved in abduction, but if we were to imagine the anterior fibers contracting, they're going to more or less attach to the anterior part of the deltoid tuberosity, more in the front of the humerus. And so the anterior fibers are actually going to cause shoulder flexion. They're going to tend to bring the humerus actually more in front of the body, okay? The posterior fibers, they still attach on the deltoid tuberosity, but they're more on the posterior side. And so if the posterior fibers of the deltoid contract and shorten, they're going to more or less pull the humerus in the direction behind the body. So when you talk about the deltoid, we normally think of it as being simply shoulder abduction. But keep in mind, those are mainly the middle fibers. If you have the posterior fibers, they're going to facilitate shoulder extension, bringing the humerus in the direction behind the body, whereas the anterior fibers are going to facilitate shoulder flexion, bringing the humerus in front of the body. Let's now look at the origin and insertion of the deltoid. We can see here that the origin of the deltoid is from the clavicle to the acromion to the scapular spine. However, normally we'll just simplify it by saying that the origin is the clavicle and the scapula. And when we looked at this, let's go back here. we can see that if we rotate this upward, that part of the origin is actually on the clavicle right here, and then the other part of it is actually just on the scapula. So we could more or less say that the anterior origin is the clavicle, and the posterior origin is the scapula. Hopefully that makes sense. And the insertion of the deltoid is going to be on the humerus, more specifically the deltoid tuberosity. Now, if we look at the deltoid, we can see that it's going to insert at this one point here, because it's a convergent muscle, just at one point here on the humerus. It's going to occur about 1/3 down the distance of the humerus. And you can see here when we remove the deltoid, there's a small bump right here. That's the deltoid tuberosity. If we go and take a look back at this image, let's rotate this, we can see the deltoid tuberosity right here. This bulge that's sticking out of the humerus, again about 1/3 of the distance down it. Also of note is that shoulder abduction is assisted by one of the 4 rotator cuff muscles called the supraspinatus. Now, I won't go in a whole lot of detail about the supraspinatus or rotator cuff here. That's in a separate video, which I'll put a link to in the description of this video. But what's worth noting is that notice the deltoid actually inserts all the way down here on the humerus at the deltoid tuberosity. If we look without the muscle, that's approximately right here where my mouse is. However, the supraspinatus inserts way up here, really more on the head of the humerus, and it's actually at a point called the greater tubercle. And so for that reason, the supraspinatus has a poor mechanical advantage. The deltoid has a much greater mechanical advantage. So in addition to the deltoid just being a much larger muscle, the deltoid also has a better mechanical advantage, and so overall the deltoid lifts the vast majority of the weight in shoulder abduction. However, the supraspinatus initiates the movement. And one thing that's notable, and you might hear this if you ever shadow at a physical therapy clinic, that even in the case of a supraspinatus tear that's minor enough, some people may not actually know they have a supraspinatus tear because the deltoid can more than compensate for a torn supraspinatus. They do the same motion, but the deltoid lifts the vast majority of the load. Now let's talk about shoulder adduction. This is the opposite movement. So if you imagine your arm starting off in a more abducted position, so all the way up here, if you bring that arm back down toward your midline, so toward your body, in the frontal plane, that movement is called shoulder adduction. Examples where you might see shoulder adduction would be in the downward phase of a jumping jack, as long as you're forcibly moving your arms downward. If you're just kind of letting them fall, which is not really what you see in a jumping jack, then that's not actually true shoulder adduction. But if you're forcibly moving your arms downward, that's shoulder adduction, and that's using the adductor muscles. Another really good example of one is actually the breaststroke in swimming. So if you actually do the breaststroke in swimming, you're actually forcibly adducting your arms, moving them down toward your midline to propel yourself forward in the water. And there's 2 major muscles that are going to be involved in shoulder adduction. The biggest one, which is also going to be extension, is going to be the Latissimus dorsi. Okay. There is also assistance by the teres major. We'll look at both of these muscles. So here's the Latissimus dorsi. It's a very, very large V-shaped muscle. Okay. And we see that it actually inserts right here on the humerus. And so what we can say is that as long as you're moving in the frontal plane, when the Latissimus dorsi contracts and shortens, it's going to pull the humerus toward the midline. Now that we've seen the Latissimus dorsi, or lats, let's take a look at the origin and insertion specifically of this muscle. So what we can see is that the origin of this muscle is actually going to be the lower thoracic and lumbar vertebra, and then also the iliac crest of the pelvis and the sacrum. Now, when you're looking at the Latissimus dorsi, all this white right here is going to be the origin. Okay? It's a giant aponeurosis that is like, it's tendon-like, that connects the muscle itself to these bones. So you've got some thoracic vertebra right here, you've got your lumbar vertebra, and then you've got the iliac crest, you can see that right here, and then the sacrum down here at the bottom. Those are all attachment points because we, again, have a very, very large origin, okay? Because we have an aponeurosis. That's typical of these kind of muscles. And the insertion is just going to be the humerus, okay? So hopefully that makes sense. Now, as I mentioned, this motion is also facilitated by the teres major. Now, the teres major is a muscle distinct from the teres minor. Remember, the teres minor is actually part of the rotator cuff. Teres major is not part of the rotator cuff because even though it originates on the scapula, it's actually the very bottom of the scapula, it does not insert on the glenoid cavity. Okay? To be a true rotator cuff muscle, the muscle would have to insert near the glenoid cavity. The teres major, as you can see over here, does not. In fact, it's going to insert very close to where the Latissimus dorsi inserts. And you can see the teres major over here as well. It's going to lie just above the Latissimus dorsi. And if we look here, we can see that for the teres major, its origin is going to be the lateral border of the scapula. If we want to get really specific, it's going to be the very bottom, as you can see right here. It's actually going to originate below that of the infraspinatus in the rotator cuff. Okay, so it's the very bottom right here, and then it's just going to insert on the humerus, very close to the insertion point of the Latissimus dorsi. Okay? And both of these muscles are going to work in tandem together to adduct the shoulder, pull the humerus toward the midline. But due to the fact that the Latissimus dorsi is so much larger, the Latissimus dorsi is going to carry most of the load there. I want to also take this time to look at another view of the Latissimus dorsi. This is the right Latissimus dorsi. And so what we can see right here, if we actually zoom out a little bit and then actually scroll down, we can see this very large aponeurosis. We see a little bit of it right here is going to attach to some thoracic vertebra, but then we have lumbar vertebra down here, and then also attachment at the sacrum. Okay, and then this right here is the muscle itself, and then if we rotate this, we can see that it's actually going to attach on the humerus. Okay. And you can probably rationalize that depending on which part of the Latissimus dorsi contracts, it's either going to extend or adduct this arm. Okay? It's also worth noting, because this is a good landmark, that right above the Latissimus dorsi, and actually overlapping a little bit of it, is going to be the trapezius. Some of the Latissimus you won't be able to see, and if you actually think of cutting off this bottom part of the trapezius, you would actually have Latissimus dorsi under here and more attachment to the thoracic vertebra up here. Okay, but the trapezius is also very large, and the inferior part of it is actually going to cover up part of the Latissimus dorsi. Now, it's also worth mentioning that for both shoulder abduction and adduction, we have to have a corresponding movement of the shoulder girdle. So here's our shoulder girdle movements, or scapular movements. For shoulder abduction, the corresponding movement of the scapula is upward rotation. This bottom part of the scapula, the point at the bottom, is called the inferior angle. And so in upward rotation, the inferior angle has to sort of be rotated laterally. And this is what has to happen during shoulder abduction. The muscles that are involved in upward rotation are going to be the trapezius, serratus anterior, and one of the rhomboids. And the specific rhomboid is actually going to be the rhomboid minor. And let's think about why that is. If we look at the rhomboid minor, if this muscle was to contract, it would pull on the top third of the scapula, which is where it inserts. Whereas the larger rhomboid major, which is inferior, is going to attach at the bottom 2/3 of the scapula, and so it would pull on the bottom 2/3. If the rhomboid major was to contract by pulling on the bottom 2/3, that would actually facilitate downward rotation because the inferior angle of the scapula would actually move more or less toward the midline. If the inferior angle is to move away from the midline, and sort of, in this case, the right scapula would actually rotate counterclockwise, the rhomboid minor would actually have to contract and pull on the top 1/3 of the scapula so that the bottom inferior angle would actually rotate outwards. Okay. In terms of shoulder adduction, the corresponding scapular movement is downward rotation. In this motion of the scapula, the inferior angles of each scapula are going to move more medially. They're going to rotate internally toward the midline, okay, as you can see here in this image. The muscles of downward rotation are going to be the pectoralis minor, the levator scapulae, and the rhomboids, but again, this one's going to be the rhomboid major. Again, if the rhomboid major pulls on the bottom 2/3 of the scapula, it's going to pull the inferior angle actually toward the midline. It's going to internally rotate that inferior angle of the scapula, thus producing downward rotation. All right, now let's switch gears and talk a little bit about shoulder flexion and shoulder extension. So flexion and extension of the shoulder are actually going to be movements of the humerus that are going to be occurring in the frontal plane. Okay? In general, if we have a person in anatomical position like this, and here's our frontal plane, shoulder flexion is going to be involved in motions such as the bench press or pectoral fly. So if you imagine a bench press, you're lying on your back and you're holding the bar and you're pushing the bar upwards. You're actually moving both of your humeruses in the direction in front of that frontal plane. That's considered a type of shoulder flexion. Pectoral flies are the same way. That typically occurs with a dumbbell in each hand. But in a pectoral fly, in the up phase, you're actually moving those arms in front of the frontal plane or in that direction. And even if you threw a punch in front of you with either arm, that's still moving your humerus in the direction of in front of that frontal plane. And the major muscle that's going to be involved in that shoulder flexion is going to be the pectoralis major. Okay, and you can see here, these are the chest muscles. What we see for the pectoralis major is that its origin is going to be on the clavicle, sternum, and the costal cartilage of the first 6 ribs. And then the muscle is going to insert on the intertubercular groove. So in this image right here, we can see that each pectoralis major muscle has a large area of origin on the sternum. It's also going to originate on the clavicle right here, and then some of the ribs, which you can't really see right here, but there's some ribs right here where there's some origins. And then this point right here on the anterior surface of the humerus, each one of these is the intertubercular groove. That's the insertion point of each of the pectoralis majors. And when it contracts, it's going to pull those humeruses in front of the frontal plane, or at least in that direction. Okay? We can take another look at the pectoralis major. Let's look at it right here. So what we can see here is we can see this aponeurosis right here of the pectoralis major. We can see that it actually connects to the sternum. Okay, that's one of its origins. It's also going to have some of its origin on the clavicle, not all of it, but some of it. Some that you won't be able to see too well. Maybe if we turn this around, you'll be able to see that some of the ribs are actually going to have part of the origin on them. And then we see here the insertion right here on the intertubercular groove. And so when this contracts, it's going to pull in the left direction, at least as I have it right here, and that's going to move the humerus in the direction in front of that frontal plane. Okay? It's also worth noting that the pectoralis major is going to be facilitated by 2 muscles that are going to be shoulder girdle muscles. One of them is the serratus anterior, and the other is going to be the pectoralis minor, although the serratus anterior is more important. Go back and watch the video on scapular protraction to really get a feel for that. But it suffices to say for now that shoulder flexion has to be accompanied by scapular protraction, in which the scapula actually move away from the midline and sort of follow the humerus as they go in front of the frontal plane. And you can kind of see this guy's arms more or less in front of that frontal plane here. All right? So hopefully that makes sense. That's the pectoralis major. The other muscle that's going to be involved in shoulder extension is also the latissimus dorsi, which we saw worked in shoulder adduction. But the latissimus dorsi is also going to be involved in shoulder extension. Just as in the case of shoulder flexion, shoulder extension also has to involve a scapular movement. The scapular movement that is going to be involved here is going to be scapular retraction. So the way to think about this is if you're moving your both humeruses more in the direction behind your body, if the scapula didn't move, the humerus, at least the head, would kind of crash into the scapula, and that wouldn't be good. So in order to make way for the head of the humerus, both of these scapula have to move toward the midline, or they have to retract, which is called scapular adduction, or I'll usually refer to it as retraction of the scapula. Okay? And the muscles that facilitate scapular retraction are mainly going to be the rhomboids. Okay? As we saw in the scapular retraction video, there were some other muscles. In fact, if we go look at those very briefly, we see that the levator scapulae also played a role in the middle fibers of the trapezius. Again, make sure to go back and watch that video for more information on that. But it suffices to say for now that the rhomboids are going to be the major muscle involved there. In fact, when you perform rows or lat pull-downs, you're working both the lats and the rhomboids to some extent. Okay? It's arguable, though, that rows, such as the ones that she's doing here, not lat pull-downs, are actually going to be working the rhomboids a lot more than lat pull-downs do. Okay? But hopefully this makes sense, and hopefully this video gives you a good understanding of the differences between shoulder abduction and shoulder adduction, and then also shoulder flexion and shoulder extension. Please make sure to like this video and subscribe to my channel for future videos and notifications. Thank you very much.